Good, e- Good evening, everyone. Welcome to another session on day one. And the focus of this session is on research in India and what role patients can play. This is something I would say is very relevant because obviously we have a big population, and there are multiple ways by which India can contribute to science and help in improving research, not just in India, but all over the world. And I have the pleasure of introducing Amita ma'am. She has been my mentor and teacher at SGPGI and has imbibed this culture in us to not just take care of patients, but give back to society through science, through research. And we also have Mudita. She's a lupus warrior, and she has also agreed to take part in this session. So without wasting much time, I would first like to request Mudita to introduce herself, and then Amita ma'am.
You have to unmute.
Good evening, all. I'm Mudita from Prayagraj. I'm in teaching profession. I am teaching computer science in a university in Allahabad. Um, I'm a lupus patient, and I met Dr. Amita at SGPGI Lucknow. And then I also have an urge like patients must participate in such a way so that we can aware other people to early detection of any disease. So like ma'am when asked, then I volunteer myself for this session. Thank you.
I'm Amita Agrawal. I'm at SGPGI and I have passion for lupus. And I've been seeing patients with lupus since I think 84 or even earlier when I was at All India Institute. And I feel that as a physician, our job is not only to treat patients, but also to make them acceptable in society, make them useful in society, and in turn, encourage them to help the society look after this disease. So that is why I've been trying to make patient groups where patients can interact and solve their own problems. A lot of problems can be solved by patients themselves. So thanks to Avinash for inviting me here.
Thank you, ma'am. Thank you, Mudita, once again. So let us start with some of the questions which are often they come in our mind and even patients' mind and even a healthcare professionals. So Mudita, we'll start with you. Do you think research is useful? And if yes, what is your take on that?
Yes, research is definitely useful. Like in present scenario, we see that COVID has come and we developed the vaccine just by a quick research, and we have implemented. So we are doing far better than other country now in our country in terms of patients' death and all. So definitely research is very important to do modification, come out with good drugs for the better patient recovery. Definitely. And I'm
Right.
very thankful that I am part of this as I volunteer myself as when ma'am asked
Right.
for it.
That's great. That's really well said. Ma'am, do you think that Amita ma'am, do you think that a patient who is participating in research, does the research help him directly or indirectly?
Research definitely helps future patients because when we start research, we have a question in mind and it may or may not affect the patient who's participating in the research at that time. But I feel that the patients get some indirect benefit definitely because when you when they do participate in the research, they also have a feeling that they are doing something for society. So that
Yes.
gives them a positive thinking. The second, it has indirect benefits like we see those patients out of turn. We give them a special status. So they have more organized care. They get more education about the disease. And sometimes they have even access to costly drugs, which are not available in our country or the patient cannot afford. And Furthermore, some tests which we normally don't do are done for those patients. And in some cases, we can also give them treatment for some abnormal test. And finally, which we don't do in our country, but in other countries, patients also get some monetary benefit for participating in the trials, which our country feels is not a good thing. So we have not encouraged that.
Yeah, I also agree with your thoughts. And in fact, on one of the occasions, one of the patient relative was saying कि डॉक्टर साहब आपके messages का भी reply कर देते हैं. You must be participating in some research, which I agree is, we tend to develop that bond also with these patients because they're always there with us. They come regularly on follow-up. That's how we encourage. So Mudita, tell me, I think you have already mentioned you did participate in research, but were you approached for it? When was it? And how was your experience?
Pardon?
What I was asking was, have you ever been approached for research? When was it? And how was your experience?
Okay. I was when I detected this autoimmune disease, so I went to SGPGI, and thankfully I met Dr. Amita ma'am only. So she said ki, she detected my disease after some time when I keep on going for follow-up. So she said ki, we are doing one research project, and would you like to enroll in that, because you have to keep a regular follow-up, and like for the sample and all, you have to agree when we ask for the sample. So I said I definitely participate in this because it will be beneficial for others in coming future. So
That was
definitely
really,
one should volunteer.
yeah, no, that's good. That's really thoughtful of you, and to agree. And this is what we also would want all patients to understand, this, that it is very important. And a few ml of blood from your pool of blood will not result in
nothing.
that is it. And did you, even after when the disease was diagnosed, you came to know about research opportunities? Did you on your own try looking up for other opportunities or what is happening in the research world? मतलब क्या आप इस तरह का homework या कभी कुछ किया है? Did you ever Google that
No,
up
I
also?
never did. But like I have this, ma'am, we should spread an awareness so that this disease be detected early. So ma'am, then let me know. I said ki we can now do digitally also. We can make some in online world. We can impact more people. So ma'am also told me ki they are creating one group, and she added me there, and we started nurturing others, and so that they also come to know about this thing early, so that they should not fall under the consequences of the severity of this disease.
Yeah, I agree. That's important, because spreading awareness about disease will also help them understand what the disease is about, and then they can probably actively participate in other activities associated with the disease.
Yes.
Totally agree.
Because generally what happened with the patient ki thoda aram milta hai, then they leave it. And then they don't follow it, medicine and other things, and then later on again they get some or other thing.
Yeah. This chronicity is a big challenge for such autoimmune diseases.
Yes.
Amita ma'am, what are the challenges have you faced as a researcher as far as participants are concerned? What problems do you generally face?
Major problem in a study where you are going to do suppose a drug trial, and you tell the patient that you can be either in the drug or not in the drug group. So the patients find it very difficult to understand that why should I not be in the drug group? Because everybody believes the drug is going to work. While we tell them that we don't know if the drug is going to work or not. So this concept of equipoise is very difficult to understand for patients. The second, the need to have a regular follow-up. As Mudita just now said, that as soon as the patient gets well, patient feels why I should go again and again.
Yes.
Then the need for giving blood samples. In the beginning, everybody is very positive. But when it comes to repeated blood samples, obviously I can understand. Nobody wants a prick. And it's only the pain of the prick. But still, it is understandable. But for research, we need to do something in the blood sample. So we need the blood sample. So we are trying to do studies where we don't need blood sample also. The third is that there are some instruments or some things which we measure, which our patients find it very difficult in India to understand. Like we ask them, can you grade your pain on a 0 to 10 scale? They will look at you absolutely blank. You tell them, okay, 0 means no pain, like me, I have no pain. 10 means patient who has an accident, who's crying in pain. So in that scale, what is your pain? So patients in our country, we are not taught abstract thinking. So they will say, from the last time, I am 50% better, but they cannot say at this time, what is their pain scale. The last, which is most important, is compliance with drugs. Invariably, about 50 to 60% of patients will down titrate their drug. They think that this drug is not needed, or I can reduce the amount. So that are the challenges which we face as researchers. But I feel still, if you keep constant contact, you call them up, you send a WhatsApp message, you are there available with them 24/7, you can improve upon all these things.
Yeah, I agree particularly with that lack of abstract thinking where, जब हम लोग पूछते थे वो बोलेंगे बीच में लगा दीजिए डॉक्टर साहब कहीं बीच में 5 पे 4 पे something like that. So that's a challenge. But then that will probably not also help them understand their disease. Ki, okay, there is something scale with which we can compare. And so Mudita, back to you again. Do you think, or were you ever scared on the first time when you were asked or told something about research? And do you think patients get scared? And why do you think that might be the reason?
Maybe patient get scared, but I didn't because I have this approach like how we can help the society. This thing within me also.
Right.
So
Right.
somehow when ma'am asked, so I said, okay, yes, I will do, because definitely we can if something good come out of it, future generation will get help
Right.
of this. Yes.
Right. Yeah.
Mm.
Yes, I also agree that
Generally, people get scared. They
mm,
try to get away from medicine and other things also. So,
mm,
and they think yeah, unnecessary. Why to involve in this stuff?
right. Right. हमारा कुछ ले लेंगे kind of
हाँ
fear is
हाँ
there at times.
कि ऐसा कुछ
But
भी नहीं
then
लेते हैं
but
ऐसा
then
कुछ
I
भी नहीं
agree.
लेते
Yeah.
हैं हाँ
The
yeah.
point that you mentioned, ki if we persistently, educate them and tell them, then probably they would understand. It's just that we need to spend time. The only problem is with that busy OPD, sometimes it's difficult. And I remember Amita ma'am had suggested me ki research ke liye, samjhane ke liye, it's always good to have another day, spend some time with the patients, and then it's
Nurturing is
always
also education, and nurturing
exactly,
is
totally
is a
agree.
very essential part.
Right.
And like this disease has symptom like this, nobody can understand, like joint pain, mild fever, fatigue. So they think ऐसा तो सबके साथ होता है.
Right.
Nothing
Right.
special. और
Yeah.
why these doctors are unnecessary making us share कि you are having something different. It's not a regular fatigue or
Right.
fever or
Right.
pain.
Yeah. That's another dimension to the disease, the symptoms which people don't see from the top, and then they feel what is happening.
Yeah.
So my final question for the session would be for Amita ma'am. How has management changed over last decade in as far as this so-called research is concerned? How has that helped so that patients understand what has researched which was done maybe 20 years ago is helping them now? That is what probably helped them understand if they contribute, they are doing it for their future generation, because it's a long battle, it's a long disease. So how has management and prognosis changed over last say 20 years?
Avinash, Mudita just said that COVID-19 is the best example.
Right.
And this mRNA vaccine has not come in one day. People were trying to make mRNA vaccine for the last 10 years, and it had never been experimented out. And here there was an opportunity because of the pandemic. And see how much success has come out of this mRNA vaccine. Same way, adenoviral vectors. I mean, they had been tried only very few cases. And now we have that vaccine, which we are all of us have got Covishield. So I think this is a prime example of how research done in the last 10 years has helped mankind in a pandemic situation. Right. And you could get a vaccine in 10 months. Like it is unheard of.
Yes.
If you take example of lupus, In lupus, we didn't have much drugs. When I trained, we used to just give cyclophosphamide, corticosteroids, and chloroquine. We didn't even have hydroxychloroquine in India. As you know, hydroxychloroquine got licensed in 1957 for lupus. And after that, it took 50 years to get the second drug license for lupus, which is still not available in our country, belimumab. But now, because of so much of research, we have 2 drugs coming up with this year, voclosporin and anifrolumab. So you have even managed to get a drug, an oral drug. And maybe in soon, we will have more drugs, which will be acceptable to our patients, which will be cheaper, that they will be tablets, which can be given. And outcome of lupus has really changed in 50 years. But the disease which used to kill has now become a chronic disease. It doesn't kill now anymore. Very few patients, maybe 5% or 10%, will die. Rest of them will live with it and live more comfortably than what they were living 50 years ago. So I think it has made a marked difference to lupus. Patients have become much better. Quality of life has improved. Their survival has improved. Their organ damage has improved. But we still have a long way to go. And that is why we need to do further research.
Right. Yeah, totally agree. Totally agree with the how things probably people have best understood it with COVID. How such stupendous research has really helped, such amazing work. And so, yeah, that's how hopefully most of you who are watching must have learned that research is important. You should actively participate because, books can only teach us to a certain extent. हम लोग जो आपसे सीखते हैं उसको औरों पे apply करते हैं. There is nothing like that. So if this research becomes a habit, it will be great. And this also gave me an idea. If our websites and our web pages too should have sections where they talk about research. What is the importance of research? What research will do? Because if people Google up and read about it, they will realize the importance of it. So thank you, Amita ma'am. Thank you, Mudita. It was a very good session. Thank you for your time.